You tell me I can start doing more activity?
See, that's called hearing what I didn't say.
No!
No, you totally, yeah, you got, I'm just kidding. Hey everybody, this is Dr. Warren here. I'm Stephanie. Stephanie, we're not crying, okay? But it's a new menthol rub that we have in the office, and so if I start kind of looking a little shimmery in my eyes, it's because we're just helping out her knee. That's what's going on, okay? Quick rotation, explosive athlete here, opening up, and she rotates out, and boom, she hurts her knee. Inflamed, swelling, pretty intense. Can't walk on it.
No, it was pretty bad. Pretty scary.
Yeah, the suddenness of it, the intensity of it, and then like joint inflammation in the knee will make you kind of give out. It's kind of counterproductive to living a little bit when our body does that to us. It's like, let's protect this, fall to the ground. Yeah.
Pretty much.
So swelling, and so she came in on Monday. Stephanie came in on Monday and said, I don't know what I did, just turned pretty quickly, and then boom, my knee inflamed. No history of this happening before too, which is not very common. So we're like, what's going on? Went through all the orthopedic tests, very stable. Inflammation to the joint capsule with that rotation, like a sprain strain to the joint. And when we deal with joint related issues as chiropractors, as PTs, as DOs, etc., when we do manual therapy to a joint related issue, we tend to have really quick turnarounds. It's very effective as a good catalyst for good motion kicks off a good cycle of healing. So what did we do?
We did some dry needling, which
yeah, we did.
Had it a couple times in other areas, and I don't like needles, but I will consistently come here and be like, please just do it, because it just works every time. Over all the different areas that I've had it done,
yeah,
it just always feel better pretty quickly. There's
not very many people, but like people are lining up, be like, I feel good, but I just can't wait to get needled to my knee. Sign me up. And if they come in like that, I'm just like, okay, we got
yeah.
know. But no, it's not comfortable all the time. But it's very effective for this type of a problem, for muscle spasms, for pain in general in a tissue, and as our body is dealing with pain centrally as well as peripherally. Okay, so that's helpful one. And then you got, remember the name of the stretch for your knee?
Yeah, the Mackenzie's.
Let's go.
Right?
That's right.
Okay.
Yeah, Mackenzie Stretches is the name of a PT out of New Zealand, I guess a physio, and it's a good modality or approach, joint by joint based approach for centralizing pain. Basically, it's good for joint pain. Whether a lot of people know it for low back, disc problems, sciatica, etc. But in this case, we did knee Mackenzie's, and very helpful. And I know it's helpful, and I know I've got good momentum, because what will happen is, and she did this on Tuesday, she came in for a massage. Shout out to Art.
Yeah, it was great.
The legend, who's here, who does hour-long massages with people in the office. But she came in and she goes, hey, I really like those stretches. The more I do them, the more it helps. I'm like, oh, we got momentum. Dry needling, soft tissue work. Let me show you what I'm doing with my hands now, okay? So, relative to the combination of care that she's getting in here, just to kind of summarize all that, we did an exam. We did orthopedic testing on her knee to make sure there was not instability, and more importantly, she responded effectively to a treatment plan. And that treatment plan consisted of ART, soft tissue pendant stretch on the quad adductors and on the popliteus muscle, which we'll get to in a second, adjustments to the ankle, hip, and low back, and then dry needling. So we've gotten a lot of different practices or approaches relative to this problem. Yeah, nice. So I'm just gonna help her out now. Okay. Relax your whole leg. There you go. Adductor hiatus, a little sensitive there always. That's not a muscle, it's just sensitive tissue. Put it that way. And then we're gonna go up into this muscle. Let your knee come up. Good. And then let it come out towards me a little bit. Good. Feels pretty good through here. Little spot right there. Bring that. Come on out towards me a little bit. There you go. Hey, Carly.
Yeah.
I broke the wall. Anyways, broke the fourth wall. There's a little soft tissue can over that touch always. I'm not very good at that.
This guy?
That's it. Hey, that's the new Flex Balm in here. Shout out to Dr. OG, who is giving us a good menthol soft tissue cream to use. And you can find the link on the top there. Support her. She's awesome. She's local. Small business. Hard worker. Uses good quality ingredients. It's pretty rare to find that. There you go. I hope she's wildly successful. YouTube, hit her up. Knee comes up. So in like 30 minutes, I just gonna get it warm.
Okay, good.
It'll feel really nice.
Fantastic.
Okay. And it should last a couple hours. It's pretty good.
Sweet.
Now, this doesn't talk about like oils healing ourselves. Yeah, to a certain extent. But what's gonna help you out the most is moving it the right way.
Okay.
And progressively loading it. And it's gonna feel good to do that now that you have this topical on there.
Okay.
It's a win-win.
Okay.
You know what I'm saying?
I hope, yeah.
Yeah? Do you know
I think so. You tell me I can start doing more activity?
See, that's called hearing what I didn't say.
No!
No, you totally. Yeah, you got. I'm just kidding. Yes. Yeah, as tolerated. Yep. So, I think that what cardio do you like to do? Are your HIIT classes, right? You get after it? No, sorry.
No, it's okay. I'm hilly walks. I take my dog on long hilly walks, and then I walk on the treadmill on the hill.
On the hill. So you like the cardio.
I do.
From a hill standpoint, do you ever do farmers walks on those?
I haven't, but I've done regular farmers walks. That's a good idea.
1 mile farmers walk. You're strong. Grab like a 25 or a 20.
Okay.
Do a mile.
Ooh.
3/4 of the way in, you're gonna be like.
Ooh, that sounds fun.
And it's a really
like
way
a challenge.
It's gonna push your cardio.
Sweet.
It's like a core shoulder workout too.
Yes.
It's a great way to work on posture.
Oh, I like that idea.
And it's a safe way to work on like lower extremity strength too. Because
Okay.
people are like, I don't want to run. Well, okay, just walk with weights in your hand.
Yeah, that's cool.
And not like the.
Right.
I mean, do that though. There needs to be more people doing that one.
The like twisty one.
Oh, you throw the twist in
I have a
there?
twisty
You
one.
got the twist going on?
Oh, man.
That's what happened to you.
That's actually what happened. Actually, I was twisty power walking.
Yes.
So good.
Lord. There you go. Straighten that leg for me. And bend your knee. There we go. Now I'm starting to get some range of motion. Some stuff's going to release and pop. It's okay. It's all good. Just pressure releasing. Come back up. Good. And flex. Keep going. All right. So this is strain to the joint line. Oftentimes, not as much here, but oftentimes meniscus can get inflamed too, just like the joint capsule does. And a lot of these things that I'm talking about doing for people, for Stephanie, help people with a meniscus irritation. So I usually might throw in some shock waves. She responded within 2 sessions. Like, she couldn't walk, and then she's like, can I get back to doing my thing? Which is good, but sometimes it takes a little longer for when it's a meniscus.
When can I start lifting weights?
Yes. Yeah.
Real question.
Yeah, totally. I think that if you're in a good space relative to the movement, and you have good control, and you don't feel like any twinges or discomfort in your leg, you're probably about like a couple days away. You're gonna get to the point where you don't think about your knee anymore.
Okay. That would be
I really think you're around the corner from that.
Okay.
Usually I push it back a little bit more, but it's a risk you can take. Like, what's the documented amount of time that you need to rest for this is 4 to 6 weeks, But okay, I'm playing sports too. I'm getting there.
Right.
So being smart about it and being like, do I have control? Do I have function? Is it aggravating me? You can probably do some upper body workouts. You'll be all right. Now, if you do split squats
Right.
with like a jump at the top and a scissor kick, you're like, you said I can lift.
Yeah, I do split squats, but I don't jump, so I will wait on the.
You're not throwing like haymakers with the foot
I'm
at
not.
a bag.
I'm not. It's a little advanced.
I'm not either. Yeah, so I would just say be mindful of it. That's good. And then the great thing about the McKenzie's, now that you're recognizing how good they make you feel, they'll actually make you less susceptible to straining this tissue
Okay.
prior to a workout if you prep the joint that way. So think of it this way, like when you put that good sensory input, like adjustments, you're like, I feel free, I feel that's control. And you'll have that same motion control around the quad and the hamstring after doing Mackenzie's. Okay. Good. You're gonna feel your ankle release here. Good. Alright. Let me know if there's any discomfort. Awesome. That was pretty provocative for pain on Monday. So I'm excited for her on that. It's moving smoothly. You're like, alright, now I'm definitely scheming up my workout right now. It's good. There you go. And then you can rest on your stomach and relax. I'm going to show some soft tissue work on the popliteus. I'll get you later on. I'd make sure that was on the right line for a second. All right, relax. Oh, it's Thursday. Let's go. I'm excited. What are you doing this weekend? You having fun?
Yeah.
All right.
Getting some friends together on Saturday.
There we
and then
go.
Went out to dinner with some girlfriends on Sunday.
Oh, girls' night. That's always nice. Careful pivoting on that girls' night, all right?
I'm gonna try.
Yeah.
No, we're boring. We're just gonna go out to eat.
Listen. You say that now. You never know. Bring your toes to your shin. Good. I'm working on the gastroc, and I'll go a little deeper. Push to your tib. I'll shorten, lengthen, relax. Curl the foot out and in, and she'll feel like a little bit of a deep tension there. Nice. I don't know what I'm doing this weekend. I want to go up to the Steelers-Ravens game because it's going to be a good one. And I have all this family in Pittsburgh, and I would love to see them. Yeah, I've got a lot of uncles and cousins in Pittsburgh that are chiropractors.
Oh wow!
But
I was just reading that on the
not why I
website.
love
Like
to
your
see 'em. I
whole,
love
like,
them. They're
you
cool.
have, like extended family of chiropractors.
Oh yeah. Tom was the first. My father graduated from the Naval Academy, and then after the Naval Academy, and then he served for a long time. And then he went to chiropractic school, and his brother, Tom, convinced him to do it, or encouraged him to do it. And then Bob, Billy, and then Randy, Jillian, Jesse.
Wow.
Those are my cousins.
Wow.
Yeah, then they're good. Randy and Jill. Jesse, I think, is not practicing anymore. But they're great. Here you go, relax. So this is popliteus. Oftentimes when we deal with knee, clinicians and patients alike can't and don't work the back of the knee. It's such a helpful way to release tension. And I'll show you the adjustment that I do for her on this one. Yo, you hear that breath? It's because it's intense. Hamstring, gastroc hamstring tendons crisscross. I'm just feeling how they're sliding on her. All of this is to improve the motion around the joint, take some stress off the joint, and to make it feel better. And then incorporating some smart PT programming that we have here is her next bet, but she's probably going to jump the gun and just get after it this weekend.
No,
just kidding. Here you go. Bend your knee for me. Go into the tibial plateau and relax. And let your foot hang over the edge of that. Like this. There you go. You're going to feel a lot of pressure. Yeah. But no dry needling, right? Easy, I gotcha. Pressure. Pressure. Good. Okay. You're gonna feel a release from your into your low back and your hip on the side, okay? Breathe in. Easy, relax. And relax here too. Your foot, let it drop. There you go. Good. Let your knee kind of slide. Breathe in low. Good. Do that again. A little lower. Good. Good. So I'm looking for a release in her SI joint and her hip and all that. Take a deep breath in. And easy. So that I don't underestimate that adjustment. And I'll never forget a clinician at Walter Reed who did that. This guy's like, my back pain's completely gone. And I was like, that's all it takes? Not always the case at all, but it definitely helped that guy out a lot. And I found really good benefits with creating traction through the hip and releasing tension in the SI joint that way. Look forward a little bit for me. Easy. Good. All good. A lot of pressure right here. It's going to feel good. There you go. All right, sister. Okay. Most importantly, you feeling good? Mm-hmm. Coming off the table? Mm-hmm. Connected to your knee?
I am quite. Oh, look at that, man.
Are you good?
So good.
That was awesome.
No, I'm not even saying this because the cameras is...
Jen, yeah, man. I'm glad to hear that because, man.
That's just... Where's that little twinge of pain that I had right before I came in here?
Don't go try to find it now. No, I'm just kidding. Exercise, load, progress, less inflammation. She's awesome. So it's easy relative to in this kind of a case. So keep up the good work for yourself. Keep taking care of yourself. Thanks for watching. That's all, Carly. Did it again. Shoot.